What is the best method to minimize the risk of air embolism when setting up the CPB circuit? A. Use a large volume of saline to prime the circuit. B. Perform a slow and careful check for air bubbles at all connection points. C. Set the pump flow rate to the highest setting. D. Use a vacuum system to remove air from the circuit. Answer: B. Perform a slow and careful check for air bubbles at all connection points. Explanation: to minimize the risk of air embolism, it is critical to carefully check all connection points in the circuit for air bubbles, especially when priming the circuit. Air should be removed slowly and methodically from all lines and reservoirs. During CPB setup, which of the following should be checked to ensure proper perfusion pressure? A. The temperature of the oxygenated blood. B. The function of the blood pressure cuff. C. The integrity and pressure levels in the arterial line. D. The speed of the CPB pump. Answer: C. The integrity and pressure levels in the arterial line. Explanation: proper perfusion pressure is critical to ensure that blood is effectively distributed throughout the patient's body. Monitoring the pressure levels in the arterial line helps ensure that blood is being pumped with sufficient pressure to maintain organ perfusion during bypass. Why is it essential to check the oxygenator's functionality before initiating CPB? A. To prevent hypoxia by ensuring proper oxygen exchange. B. To ensure the oxygenator is at the correct temperature for the patient. C. To minimize the risk of clotting in the oxygenator. D. To prevent excessive oxygen levels in the blood. Answer: A. To prevent hypoxia by ensuring proper oxygen exchange. Explanation: the oxygenator's primary function is to oxygenate the blood and remove carbon dioxide during bypass. It is essential to verify that the oxygenator is functioning correctly to prevent hypoxia, as this could lead to organ failure or other serious complications. Which of the following is a common safety measure to prevent blood clots from forming in the CPB circuit? A. Ensure the pump speed is constant. B. Administer heparin to prevent clot formation. C. Set the temperature of the oxygenator to 37 degrees Celsius. D. Flush the circuit with saline before bypass. Answer: B. Administer heparin to prevent clot formation. Explanation: heparin is an anticoagulant used to prevent blood clotting in the CPB circuit. It is administered before initiating bypass to reduce the risk of clot formation, which can obstruct blood flow or damage the equipment. What should be done if a sudden decrease in blood pressure is detected during CPB? A. Increase the pump flow rate to compensate. B. Check for any occlusion in the arterial line. C. Administer vasopressors immediately. D. Decrease the oxygenator flow rate. Answer: B. Check for any occlusion in the arterial line. Explanation: a sudden decrease in blood pressure during CPB could indicate an obstruction or kink in the arterial line. It is essential to check the circuit for any issues that could be affecting blood flow, such as blockages, and address them promptly. Which action should be performed if the venous reservoir is overfilled during CPB setup? A. Decrease the pump speed to reduce the volume. B. Drain excess blood from the reservoir to restore optimal levels. C. Increase the arterial line pressure to compensate. D. Disconnect the reservoir from the circuit. Answer: B. Drain excess blood from the reservoir to restore optimal levels. Explanation: if the venous reservoir is overfilled, it is essential to drain the excess blood to prevent excessive pressure in the circuit. Proper blood volume ensures safe and effective CPB operation. What is the first step in the setup of the CPB circuit before initiating bypass? A. Connect the oxygenator to the pump. B. Prime the circuit with saline or blood. C. Verify all pressure and flow monitoring devices are calibrated. D. Adjust the heat exchanger to the desired temperature. Answer: B. Prime the circuit with saline or blood. Explanation: the first step before initiating CPB is to prime the circuit with saline or blood to ensure that all air is removed from the circuit and prevent air embolism. This step is critical to ensure smooth and safe bypass operation. What should be done if an arterial line clot is detected during CPB? A. Increase the pump speed to push the clot through the circuit. B. Administer thrombolytic agents to dissolve the clot. C. Stop the bypass, remove the clot, and check for any blockages. D. Increase the pressure in the venous line to compensate for the clot. Answer: C. Stop the bypass, remove the clot, and check for any blockages. Explanation: if an arterial line clot is detected, the bypass should be stopped immediately, and the clot must be removed carefully. It is important to check for any blockages that could prevent proper blood flow during CPB. What is the role of the pressure relief valve in the CPB circuit? A. To control the blood flow through the oxygenator. B. To prevent excessive pressure buildup in the circuit. C. To regulate the temperature of the oxygenator. D. To monitor the pressure in the venous reservoir. Answer: B. To prevent excessive pressure buildup in the circuit. Explanation: the pressure relief valve is designed to prevent excessive pressure from building up in the CPB circuit, which could cause damage to the tubing, connectors, or other components. It ensures the pressure remains within safe limits. Which of the following is the main function of the CPB pump during setup? A. To filter out microemboli from the blood. B. To circulate blood through the circuit to maintain oxygenation and perfusion. C. To control the blood temperature. D. To administer medication to the patient. Answer: B. To circulate blood through the circuit to maintain oxygenation and perfusion. Explanation: the CPB pump's primary role is to circulate blood through the circuit, ensuring that the patient's tissues receive adequate oxygenation and perfusion while the heart is temporarily stopped during surgery.